As we age, we begin to notice lots of changes. Our hair, our skin, and yes, our eyes. Cataracts are one of the most common conditions we develop in our eyes.
June is Cataract Awareness Month. Cataract and oculoplastic surgeon Dr. Harleen Bedi joins us to explain why we need to take notice. Doctors, good of you to come in and good to see you this morning.
Thank you for having me.
All right, let's begin with maybe just a definition of what exactly is a cataract.
Yeah, for sure. Cataract is one of the most common causes of vision loss in Canada. It's incredibly common. About 3.5 million Canadians are living with a cataract. A cataract happens when the natural lens of the eye becomes cloudy. So the way I like to explain it to my patients is for them to imagine a clear window, which is transparent when we start out and gets yellow and cloudy. And that naturally limits how much light gets into the room of the eye. Once the cataract develops, glasses cannot rectify the issue, and a diagnosis of cataract has to be made. Proper care has to be provided to treat the lens.
Is that the only symptom of a cataract?
Oh, there are numerous symptoms that a cataract can cause. Most of the symptoms are subtle, so most of the times people will find that they start out with dim vision. Colors can look less vivid than before. One of the more common things my patients tell me is that when they're driving in the evening, the headlights of the car can have starbursts or halos and glare around them. It gets hard to tell what the road sign coming up is or where the curb is from the tire. So those are some of the common symptoms, and if you're having any of those, it's probably time to get a dilated eye exam and have your lenses looked at.
Okay, and once we do that, let's talk a bit about treatment. How can you treat a cataract?
Once a cataract develops, the only effective treatment is surgery. And in surgery, we replace that cloudy lens, replace it with a clear implant. Now, a lot of my patients love seeing what an implant looks like, so I did bring a little sample to show everyone. That is an intraocular lens implant. It is about 13 millimeters in size, and what's remarkable is that we put it in the eye with an incision that's a quarter of that size, so about 2.5 millimeters. That's the width of a pencil tip. And what's truly exciting now is that we have a bunch of lens options. So I have patients who have walked out of cataract surgery, not needing glasses for seeing the road signs, computer, reading, or all of the above. So if you have a cataract, you're on that journey, talk to your ophthalmologist about what the right option for your eyes is.
And you said more than not, surgery will be necessary?
That is the definite treatment for cataracts once they are developed in your eyes.
And I now have so many questions. If one is impacted, can you assume that the second that your other eye will be eventually?
You know, the way I like to tell patients about that is that when you have one gray hair, you probably have, you're going to develop 10 and then
Tell me
100.
about it. Yeah.
There you go. So we can have different degrees of cataract in each eye, but generally speaking, once aging has set in, generally people have it in both eyes.
Okay.
Yeah, and it's just amazing as you were describing the surgery, just tell us a bit about what you do, because you've got to be so precise with something like that.
Oh, it's one of the most beautiful surgeries in medicine, but of course I'm biased, but it's one of the most technically and functionally rewarding surgeries to do. Patients can see right away. They really just see out of the results of the cataract surgery on the table. And it's such a rewarding thing to be able to do.
I was just going to say, not every surgeon can say that, right? They can see the results can be so immediate.
Absolutely. And it really makes a life impact on patients, for sure.
For sure.
All right. Well, some great information here during, as we mentioned off the top, Cataract Awareness Month. Doctor, thank you so much for coming by.
Thank you for having me.
Appreciate it.
This portion of the morning show is brought to you by Alcon Canada. To learn more about cataracts, speak to your eye doctor or visit seethefullpicture.ca.